We spent a lot of time focusing on chest pain and stroke care and heart attacks, and here was a population that was just begging for help.
That's today's AIDS hero, Tim Case. He recently led the way in changing how people with psychiatric problems are treated here in the Portland area. He trained 250 EMTs to initially treat and then take them to Portland's new psychiatric hospital, Unity Health. It's a ride they often took in the back of a police car, sometimes in handcuffs, but now they're being taken with care in an ambulance. I recently had a chance to talk with Tim Case about the result of this change he spearheaded back in June.
We see things from schizophrenic patients to patients with anxiety, suicidal ideations, homicidal ideations. You name it, we encounter it. The look and feel of being transported in a police car makes you feel like maybe you've done something wrong. When somebody with behavioral health issues, that's not always the case.
The thinking being maybe if they don't feel that humiliation, that rejection by going in a police car, it's an immediate warmth they might feel in an ambulance.
Absolutely. I think that's really important for patients with behavioral health issues because sometimes there's a loss of feeling of control and being in the back of that police car may affect that, whereas here in the ambulance we have a little bit more option for comfort.
I'm guessing your inspiration might come from a personal experience, maybe someone you came across that you saw benefit from this kind of help?
I don't know that I could pick any particular one. It was just the totality of seeing it over and over again, going on calls where the patient had a behavioral health complaint, but they were trying to mask it with a medical just so that they could get in the door at the hospital. And now with the advent of the Unity Center, they don't have to mask those complaints with something else. They can say that I feel uncomfortable or I feel unsafe or I'm having a lot of anxiety and I need your help. But in terms of success, you know, I think 30% of the patients that used to go to a medical ED now go to Unity. And that keeps them out of an environment that is way too frenetic, way too high anxiety for them, and puts them on the first go-around in the facility that's going to help them.
When you look to the future, you know, 5–10 years down the road, do you expect this will become protocol for many other areas?
I certainly hope so. You know, Portland isn't unique in the fact that we have a large population of patients with behavioral health concerns. This is a nationwide issue, and I hope that this serves as a model for other municipalities and EMS systems.
And Tim tells me he does not consider himself a hero in all this. He said it really took a collaboration with agencies like the Portland Police Bureau, the City of Portland, Multnomah County EMS, and the Sheriff's Department.